Okay, we are live.
Hi, welcome back to another Fresh Dental Shadowing session. And today we have Dr. Steve Barett, who's going to give his presentation.
All right. Well, thank you very much. Let's just go back to the beginning. I'm going to talk to you about aesthetics tonight and why I always have this saying that, a smile never really goes out of style. And that's why I like to talk about aesthetics. I know you guys are pre-dental students. I'm going to give you a lot of terminology that you'll hear in dental school. So, you guys are recording this. You can always go back and listen to it later. But I'm going to really talk to you about real dentistry and things that we look at every single day when we're talking about aesthetics. If you like aesthetic cases, you can certainly follow me on my Instagram. If you guys have any questions, you can either contact me there. That's probably the easiest place, especially if there's any cases that I post that you guys would like to know about. I'd be glad to share that with you. Everything I'm going to talk to you about tonight is really based on my experience. And, everybody's experience is a little different. We look at this picture, we all see something a little bit different. And that's how it is when it comes to teeth. It's not really cookie cutter. There are some nuances, especially when we talk about aesthetics. And I think maybe, after tonight, you'll get an understanding of what I'm talking about. I graduated from the University of Pittsburgh, as that's where I did my undergrad. And then I went on to Case Western Dental School in Cleveland, Ohio. And then I spent 3 years as a dental officer in the United States Navy right after dental school. This is kind of what it looked like when I was in the Navy. I was here in Orlando for 2 years. And then I spent 1 year on this monstrosity. This is the USS Saratoga, an aircraft carrier that's no longer floating, scrap metal now. And during my time on the Saratoga, that was during Desert Shield and Desert Storm. So I served during the Gulf War, which means I didn't do a lot of dentistry. I got to work on the flight deck. This is my dental assistant, Don, who actually used to work on the flight deck, and then they realized he was legally blind, and they made him a dental assistant. But during my time in the Navy, I didn't do any crown and bridge for 3 years. I did a lot of fillings, I did a lot of exams, I did some root canals, some extractions, but I didn't do any crown and bridge. And I think that's significant, especially when I talk about aesthetics, is it took me a long time to kind of learn the nuances of aesthetic dentistry. But now with the internet, the courses that you have available to you, programs like this, that you have other speakers, it's really easy. So, try to understand some of the concepts because they will become important to you, I promise you. I joined Greenberg Dental in 1991. We are located in Orlando, Jacksonville, Tampa, Sarasota, all through the corridor in Florida, and we have 85 locations. And our locations, one of the things that's unique about Greenberg Dental is we are privately owned. And we are a multi-specialty group practice, and we're owned and operated by dentists. Again, that may not be significant to you as pre-dental students, but I guarantee you that when you graduate dental school, about 50% of your classmates will be working for some type of a group practice. Right now, it's probably about 35%, maybe even a little higher. So who knows what will happen in the future. But suffice it to say, a privately owned group practice is much different than a corporate owned group practice. And our focus in our group has always been on interdisciplinary dentistry. If you're not familiar with that term, it really means a dentist that's kind of quarterbacked, a procedure that's quarterbacked by a general dentist. And a lot of the procedures are referred out to specialists to do. And so you have different teams to work with. Your patients are expecting different things. In my offices, our specialists are in the office with our general dentist, so it makes treatment planning cases much easier. Just give you an example. This is a case that we did last year where we have implants placed, a bone graft that's done by an oral surgeon. Then we go through some limited orthodontic treatment. That was done by Dr. Scott Aaron. And then I restored the case with 2 implants, and we did some bonding. And you can see what a difference it makes in before and afters. And you'll probably get the feel I'm really into photography. I take a lot of patient photographs. Everything you'll see tonight are pictures that I personally took, as well as doing the dentistry. So I am a founding partner of Greenberg Dental and Orthodontics. I am currently the clinical director. I do visit a lot of the dental schools in Florida. I run a lot of our in-house CE programs. I hire and interview all of our general dentists. Again, our importance really is on interdisciplinary dentistry. Actually, our program for mentorship was highlighted on the Dentistry Today on the cover in March of 2020. We really had an in-depth article about how we mentor doctors, mostly doctors that are right out of dental school. And we hire between 20 and 30 new doctors every year. And I really work chairside with our doctors, just one-on-one mentoring them. I am part-time faculty at LeComm Dental School. I do speak for Glidewell Laboratories, which is the largest laboratory in the country. And I occasionally publish articles for them. This is a photograph. Actually, I just worked on this patient this morning. I did her lower veneers today, but this was taken last year. I finished her work in 2020 on her upper teeth. And this photograph actually was the winner of the American Academy of Cosmetic Dentistry Portrait Smile Competition this year. And some of the other programs that I do, and you can find these online under the Glidewell Laboratory Study Club, or on smile design, or on aesthetics, or on photography. Those are other things that I normally would talk about. So let's really just talk about aesthetics and just give you an introduction to some of the terminology and some of the concepts. If you guys all know who Jeff Bezos is, who owns Amazon, one of his sayings has always been, base your strategy on things that will not change. And I guarantee you, a smile is never going to go out of style. It will always be important to people. I know a lot of you work with other dentists. Maybe your parents are dentists. Maybe you shadow other dentists, and everything looks like it's successful because that's what you see. But I guarantee you, there's a lot of hard work that went into this, and you are all going to go through this in dental school. My son is a freshman at LeComm. It's a lot of sacrifice, a lot of persistence, a lot of dedication for you guys to get to where you want to be. So let's look at aesthetics, and it is really when we're talking about beauty and an appreciation of beauty. And aesthetics follows a set of principles that kind of guide the work that we're going to do. In particular, like an artist, right? An artist works by a set of principles as they're creating their work. There's no different in dentistry. When we're creating the smile, and this happens to be veneers on a patient, and we're transforming them, we're going to follow a set of principles. Those principles in dentistry we call protocols. And it's very important that you have protocols because that's what leads to predictable outcomes. And as a dentist, you don't get paid to redo your work. So it's important that you can, you want to get to work the first time. You want the patients to be happy the first time. And the more that happens, the more you get these predictable outcomes, the faster you will become very confident in what you're doing. So those protocols for me, these are just some of them. And I put in blue all of the ones that kind of revolve around either taking a video or a photograph. And so it is paramount that you have access to a camera when you graduate dental school. You will not be able to do aesthetic dentistry and really just routine basic dentistry without having a camera. And because I'm in the dental school environment, I can tell you that that's not always what happens in the dental school. Also, taking a scan, digital scanners are becoming more popular. About 20% of offices have digital scanners right now. And certainly that percentage is going to grow by the time you graduate from dental school. So when we look at taking photos and videos, this is just one of the rooms that I use to take photography on after when I'm done with patients. Also where I shoot my video. So yeah, there's a little bit of equipment you have to have in order to do this, but honestly, once you have the camera, this other equipment is not expensive and it's very, very simple to use. I have not taken any photography courses. This is all just something that I learned on my own. And again, a patient that we take from, a really, I don't want to say an awkward smile, but a smile that she really wanted to enhance. She's 18 years old, and I think we did a great job of giving her a much fuller, brighter, wider smile that really fits her personality. You'll see under my name, it says Vision First, because I really believe that when you start aesthetic cases, you need to start with the end in mind. You always have to be able to visualize where the case is going. So I say you have to develop your mind's eye. And developing your mind's eye and understanding where the case is going and be able to see it before you ever do it really will help you become excellent clinically. Photographs, really important, not only for documentation and communication with your laboratory, with your patients, but you need to CYA. I think you all know what that means. A camera and taking photographs gives you some validity as a young doctor with your patients. It adds that predictability and confidence. Probably more important than anything, it's going to help you improve. Because you're going to take pictures, and I guarantee you're going to take pictures. And if you're like me and you enjoy this, you're never really going to be satisfied. You're always going to find something in your cases that you'd like to improve. And that will really help you focus on those little nuances. And certainly you can market yourself over time. So I always say change the way you look at things, and the things you look at will change. So once you start to develop an eye for some of the things we're going to talk about tonight, it really will help you a great deal when it comes to aesthetic cases. So I like to kind of just look at this chart, and I think if you're a dentist and, you kind of look at this graph that we created, if you kind of take no pictures or you take really bad pictures with your cell phone, you're going to treat a lot of emergency patients. We're going to say that you treat posterior teeth and single tooth dentistry, meaning you're just doing really one tooth at a time. Because those pictures are not really appealing. They don't have an emotional appeal to your patient. And patients buy on emotion. Having your smile redone and a smile makeover is an emotional decision for many, many people. You can buy a smile gallery book. And these are typically books, but they have other doctors' work in there as examples. And the problem is when you have these books in your office, you don't talk about those photographs as passionately as you would if you had done the work yourself. And you can take close-ups. This is the implant patient that I showed you earlier. And that's great. That tells a story, right? That tells us that we went from point A to point B. And there's a cost associated with that. But I can guarantee you when I show the full face picture, and alongside of that, I show a video, that has much greater emotional appeal than anything else on this chart. And so when you get to do aesthetic dentistry, or you want to kind of go in that direction, understanding it's an emotional decision by your patients, understanding that it typically is expensive to do, patients need to see a destination. They want to see where can they go? What's the potential? Because what you're looking at on the upper right screen, that's a new person. That's just not orthodontics and some implants. That's a new outlook. Just look at her face and how dramatically different she looks. So in our office, we do create these smile gallery books of our patients, and you can see cases that I've done, where we started, where we ended up. So let's look at some terminology. And this patient, her name is Bella. And we're going to look at things called global aesthetics, macro aesthetics, micro aesthetics, pink aesthetics, and white aesthetics. And what do each of those mean? So in dental school, I always say that you learn how to cross your T and dot your I's. But after dental school is when you really learn to write calligraphy, right? Dental school has a very difficult job. They have to teach you a lot of basics, a lot of fundamentals that you really can't move forward without knowing. So you get bogged down into a lot of minutia. But when you get out of dental school, you know, life, I mean, there's just a world of information out there, and you can really go in any direction that you want. So if we look at Bella, and again, these are Bella's after crowns that she has, we're going to look at some things. And we look at global aesthetics. In global aesthetics, I'm looking at the shape of her eyes. I'm looking at the shape of her face as a whole. I'm looking at the lips that encompass the teeth. And typically this is done with an unretracted smile. I just look at her this way. Every face is unique, and the orientation within that face is unique. So we're looking at after photographs. I am eventually going to show you Bella where we started, and you'll see her before. Something that's very important when you're looking to design a smile and you're taking photographs is to look at a horizontal reference. We call that the interpupillary line, right? The IP line. Just looking through her pupils, it's very important that we take this photograph and we have those eyes level, because 84, 88% of the time, this is what you're going to use. Now, some patients, their eyes are not level, and I'll show you examples of that. But a lot of our patients, the eyes are level. We need to orient this so that we can diagnose, treatment plan, and ultimately communicate with our lab technician what we want to do. The second most common line that we would use is the intercommissure line. And those are the corners of the mouth. So I mark the corners of her mouth. I drew a straight line across the top of her lip. That's the second most common line that we would use if our eyes happen to not be horizontal. Okay. And so we'll show you some other pictures. So this is a still frame from a video. This is one of my patients, and you can just see a still picture. I like video, and I like taking a still frame from a video because that's more dynamic. I catch the patient in motion and how they speak and actually hold their head and the dynamics of their lip. But if I draw some lines on here, you can see that her eyes are nowhere near being parallel. They're nowhere horizontal to each other, right? It's not a good horizontal reference. If I draw lines across the upper lip, in one photo it's one way, in another photo it's another way. So these very asymmetric type patients, they fall into that small percentage of about 10% where you have to go by something else in order to create that new smile. So if we go back to Bella, when we draw these lines and we draw the horizontal between our pupils and we draw a line perpendicular, right? That's called our midline. And I'm looking right between her eyes, the tip of her nose, down through her teeth. And what you can tell, and maybe what you didn't even notice before, was Bella has her teeth are slightly shifted to her right. So her midline is not centered. But what's important is that her midline is straight up and down. If it's not straight up and down, we would call it canted, where the teeth are just tilted to the right. And that's very unsightly. As long as they're straight, they can move slightly left or slightly to the right, and that's acceptable. Another thing that we tend to look at is the lower lip. The edges of the teeth should follow the lower lip. So our lower lip curves up. We would like our lower teeth to curve up. That means the front two teeth are starting a little bit longer and they're working shorter as they get back towards the back teeth. That's called the smile line. And so very important that those incisal edges, that they're straight and parallel to the eyes. So where that blue arrow is, you'll see a straight line across Bella's front two teeth. That line is parallel to our pupillary line, and it's very, very important. Her teeth rest gently on her lower lip. So again, if we go back to our other patient and we look at her lower lip, we look at her eyes, right? And we look at her incisal edges of her teeth. Everything's just kind of askew, and it's all over the board. These cases require a lot of planning, and that's your job as the dentist. You don't rely on your lab technician to decide where the teeth go. You as the dentist need to tell the lab where to position the teeth. So you can see this is just a close-up picture of really what's involved with this patient. And look at her teeth. That's a very dramatic problem that has to be solved with orthodontic treatment and not just by placing crowns or veneers or some type of a filling on her tooth. So if we go back to Bella, right, we're using the upper lip as a guide, that intercommissure line. And that also is parallel with the eyes. So all three of those lines, her eyes, the top of her lip, the edges of her teeth, they are all parallel to one another. The buccal corridor, if you guys haven't heard that term before, it actually refers to the negative space in the corner of the mouth. So that little dark area that you see where the tips of those blue arrows are, that's negative space. That's the buccal corridor. A lot of patients will look better if you fill that buccal corridor with tooth. If their jaw is very narrow, they have a lot of negative space, they have a lot of black space, and it almost looks like they're missing all of their back teeth. So as you design cases, that could be very, very important to you to alter that for your patients, whether you're doing that with orthodontic treatment, veneers, or crowns. When we look at macro aesthetics, we start to look at the shapes and the contours of the teeth themselves. We're no longer looking at the eyes, the lips. Those are the things of our global aesthetics. Macro, we're getting a little bit closer. And we're just starting to focus on the teeth. So as we look a little bit closer, we start to look at what are called embrasures. So the incisal embrasures are that little space, that little separation in between our teeth on the edges. Likewise, we have gingival embrasures. And those are on the tops of the teeth. That's where the gum tissue fills in. All of that can be customized for your patients. And in particular, the incisal embrasures are what we do most as dentists. Chairside, we manipulate and play with them, and we give information to our laboratory. This is a very old chart that I happen to have, and you can see the edges of the teeth are all a little bit different. Now, some of them, the nuance and differences are so minor, it's hard to even tell the difference. But it would be very important that you communicate to the laboratory the incisal edges that you're looking for. So I always try to create this in my provisionals, in my temporaries, and then I photograph it and I take a scan of it, a digital scan, so the lab knows where to go in what direction. So we just can't send teeth that we prepare to the laboratory and say, okay, create me a smile, create me some veneers or crowns, because look at all the choices they have to go from, all based on whether it's male or female or the age of your patient, or maybe the adjacent teeth. We also, when we look at macro aesthetics, we start to look at the height and width of the tooth. So teeth have a certain width to height ratio. It's typically about 80%. And an average front tooth is about 11 millimeters. And so you see people who have very short teeth or very fat teeth, or maybe they have a lot of spaces between their teeth. And now you're going to restore them. Well, if you know that 80% is a nice range, that you're going to measure a width and height and come up with a ratio, you can decide, if I restore these teeth, are they going to look good? Or am I going to make them look too fat and square? Am I going to make them look too skinny? So this is all really valuable knowledge for you to have. When we look at the soft tissue around the teeth, the soft tissue plays a part in making teeth look natural, especially if that's visible when the patient smiles. So papilla heights. Papillas are those little triangles between our teeth. And it's important that we manage that so that when we finish our restorations, we don't have spaces in there that look black. That's called a black triangle. We want to make sure that the papilla has room to function the way it's supposed to function because it's tissue. It's like a water balloon, and if you squeeze on it or push it, it's going to move. We have contacts where our teeth touch together, and those contact lengths should be different for different teeth. And they're influenced by those embrasures that you make and those papillas. They will help you adjust those contacts. When we look at pink aesthetics, and pink aesthetics are the gum tissue, right? If we took the teeth away and we just looked at the gums, that would be very important. Some people need procedures done to their gum. They're called gingivectomies, where you remove gum tissue. Crown lengthening, where you remove not only gum tissue, but underlying bone. And you reestablish those gingival heights and levels. Maybe they're not symmetrical for your patient, and we need to create them to be symmetrical. So it's important not only to look at teeth, but to also look at the gums. The microaesthetics, that's really related to the shade. In shade, if you break it down, and this will always be very confusing when you're in dental school, is its hue, chroma, and value. Hue is simply the color, whether it's red, yellow, or blue. Chroma is the intensity of the color or the saturation. How red, how blue, how yellow. And the one that's the most important of all these is the value, because the value is the light, or if it's light or bright, it has a more value. If it's dark, it has less value. It's really important because when your value is off in your final restorations, you can't fix that. You typically have to redo the restoration. Hue and chroma, you can change that sometimes with external stain, sometimes with your cements, but value is almost impossible to change. So you can use some black and white photography to look at your value. So if you look at these restorations that were done, and I didn't do these, I redid this case, but look at the grayness, look at the darkness, right? Those darkness have low value. Those are some implant crowns that were really poorly done. And there is no way to correct that with that low value. They simply have to be cut off and redone. So really important to understand that. And it will look different in different photographs. You can see between the top picture and the bottom picture, because I have a black background in there. It helps to bring out the value in the teeth, which is much easier to see. When we look at teeth, it's really important to look at texture. That's the finish, the luster, and the reflectivity of the teeth and the incisal translucency. So let's look a little bit closer. So if you look at these teeth on Bella, they have a hue, a chroma, a value, right? They're bright, so they have a high value. If you look at the texture, that luster, where the light reflects, that was done by the technician, the ceramist who made these crowns for me. The incisal translucency effects, I'll show you a little bit closer. We don't have much of those. We don't have a lot of incisal translucency, which is kind of that see-through. I'll show you some other pictures. A lot of patients don't like that. But finish and luster is very important. That texture that you see is very important in making the teeth look natural. You'll do this yourself when you're doing composites on front teeth. You'll learn to put in texture and finish. You'll learn to pick the right shade that has the right hue and chroma and value. And so these little areas are where the light bounces off, the reflectivity that we get. Again, those are called line angles. And that's something that the technician does for us. So you can see if you look at the edges of Bella's teeth, we don't have a lot of translucency. For me, I'm not a big fan of it, and patients typically don't like that, right? But you certainly can see as we go closer the texture that's in there. And you can see on different teeth, these are different patients. They all have a little bit different texture into the teeth. Right? Taking a view like this, you can see a little bit of texture into the tooth. You can see a little bit of that translucency down in the incisal, but just a very small hint of it. And again, another patient where we just have texture, reflectivity, but we don't have any incisal translucency. When you look on Instagram, you see a lot of patients that have this, which is that translucency, that grayness around the edges that you can almost see through the teeth. Some doctors like that. My experience is the patients do not. They want a much more uniform color. They don't like that grayness. They paid for a white tooth, not a tooth with a bunch of gray in it. So it really kind of depends if you're matching maybe a tooth and you have a tooth next to it that you have to match. Maybe you're incorporating that. But this is a case that I had done a few years ago that was an absolute fail. It was a disaster because the lab put that grayish blue kind of looking translucency, and you could see I tried to actually grind it off, but it was so deep into the tooth I couldn't grind it off. And I actually ended up taking these off and redoing this case without those. And this is what it looks like now without those effects being redone. And you can see what a difference it makes in her smile, where those teeth are one uniform shade. She wanted wider, brighter, whiter teeth. If this is Myra, and if I show you Myra's before picture, you'll see she had very small teeth with spaces. And she wanted to have a bigger, whiter smile or to really put the accent on those front teeth. And you can see for her, we filled out her buccal corridor. We filled out that back area where that negative space, so we don't have any negative space in there. Her teeth, they follow her lower lip. Now, she's in a very natural head position. Her head is tilted. This is not the type of picture that you would use to treatment plan. This is just more of a glamorous after shot that we use for marketing. But because her eyes are not level, it wouldn't help me to diagnose and necessarily treatment plan the case. And this would be a case where we were matching some teeth. So the front two teeth are veneers. The two teeth on the side are her natural teeth. And you can see that the lab built in some effects into the edges of those teeth to try to match the two teeth on the side. And I think they did a very, very good job. So maybe in this case, obviously it's a little more acceptable to have that translucency. But like by and large, it's not something I add into a lot of my restorations. And you can see those are the two veneers matching the two teeth on the sides. When you take shade photographs, it's important to have a lot of good shades available. So I take pictures like this all the time. We're doing the upper teeth. We're choosing some colors. Where do we want to end? And this really helps me to communicate with my patients. So white aesthetics, we just look at the teeth, right? That's all white aesthetics means. And if we look at some nice pictures that we took of Bella afterwards, just a variety, either black and white, putting her into some fun positions to get some photographs. And this is Bella where we started. And she obviously had some issues with some staining on her teeth from when she had braces as a teenager, some cavities, some old fillings. And so what I did today when I worked on her was I finished her lower veneers to match those upper crowns that she has. So like I said before, portraits are really kind of where it's at. Portraits convey a message to your patients. I mean, that's a new person. And here we only did the front four teeth. We didn't do anything else. And it was very simple, very routine that a lot of you will do. But it doesn't really matter unless you're really trying to take a photograph, because I can use this as I treatment plan other patients. I can use it in marketing. But patients are going to want to know, what happens when I get these crowns, and whatever the cost of that treatment is, what am I going to look like? And this is very powerful. And as we look a little closer, just some different pictures of different angles, only changing 4 teeth in the front. And this is actually one of our dental assistants in my office. And her work involved an orthodontist, periodontist, myself doing her veneers and her crowns. And you can see the dramatic change that we made for her, right? And being able to photograph it and highlight, because that's a whole new person. And so I urge you, when you're in dental school, to really kind of find what I say is your unique ability, right? What do you do well? Do you like aesthetics? This isn't for everyone. You really have to pay attention to detail. You have to understand the process and the protocols. Maybe you like dentures. Maybe you like root canals. Whatever it is, but find your unique ability. And it's really important to develop your talent, right? I felt that I had a talent for this. The jury's still out. I have a long way to go, but I enjoy it. So whatever you like, whatever you think your passion is, you really need to try to hone those skills. And I think that should be easy with the amount of information. I think all of you will have the ability to change people's lives. And I think that's a really important statement. I truly believe, whether you're getting someone out of pain, whether you're doing a root canal, whether you're making them a denture so they can go out of the house, whether you're doing a smile makeover, you have a unique ability as a dentist to help people and to change their lives. And I think that you should really feel the responsibility of that. And I think that'll make you feel really, really good once you get out and are able to help your patients. So with that, I would like to say thank you. I am all done with my presentation. I'll just put up my contact again, that you guys are welcome to reach out to me on Instagram if you have any particular questions. Do you guys have any questions now that we need to answer? All right. Well, thank you, everybody, for your time. I really appreciate it. I hope you all have a great evening.